medication takers? Do you think we are a society of medication takers? Ever have the feeling that there are pills to take to help for the pills you have to take? Ever ask who came up with these advisory levels to start taking medication? Hi everyone, and welcome back to the Jaxom Talks channel. Today we're diving into a topic that affects millions of people around the world: statins. For decades, these drugs have been hailed as a miracle cure for high cholesterol and a surefire way to prevent heart disease. But is that the whole story? Are statins more harmful than good? That's what we're going to be discussing today, because according to some data that's been recently published, they may actually be doing more harm than good, especially if you're not at high risk. We're going to explore the controversial opinion of a prominent cardiologist, Dr. Aseem Malhotra, who argues that the benefits of statins have been grossly exaggerated and their risks downplayed. The statin narrative versus the reality. Let's start with the official narrative. You go to your doctor, they run a blood test, they see your LDL cholesterol is a bit high, and they recommend a statin. The message is clear: this pill will lower your cholesterol, prevent a heart attack, and help you live longer. It sounds simple, right? But Dr. Malhotra, and a growing number of other medical professionals, argue that this view is deeply flawed. He points out that the studies used to promote statins are often funded by the pharmaceutical industry, and the way the data is presented can be misleading. Research has been done by the Cochrane database. They're considered to be one of the most reliable sources of evidence-based medicine. What they found is that when you look at all of the studies on statins, which show both the good and the bad, they don't seem to help people who are at low risk of cardiovascular disease. In fact, they might even increase your risk of dying prematurely. They often use relative risk reduction, which can make the benefit seem much larger than it is. For example, if a drug reduces your risk of a heart attack from 2% to 1%, that's a 50% relative risk reduction, but the absolute risk reduction is only 1%. This kind of framing can lead both doctors and patients to overestimate the drug's effectiveness. Now, this is controversial because there's so much misinformation out there and people have such strong opinions about it. Some people will say, statins have saved my life. I had high cholesterol, I was taking statins and I did not have a heart attack. Let's start with the basics. What are statins and how do they work? Well, statins are a class of drugs that are used to lower cholesterol levels in the blood. They work by blocking the enzyme that's responsible for making cholesterol. The idea is that by lowering the cholesterol, you also lower the risk of developing heart disease. But here's where it gets interesting. There's a lot of debate about whether statins really do lower your risk of heart disease and whether that risk reduction is worth the potential side effects. So what does the research say? Well, as I mentioned earlier, a recent meta-analysis published in the Cochrane database concluded that statins may not provide a net benefit for patients who are at low risk of cardiovascular disease. The side effects and the statins don't work myth. Now, let's talk about side effects. Dr. Malhotra argues that the real-world incidence of side effects is far higher than what's reported in industry-sponsored trials. He says that in his clinical experience, he sees a significant number of patients who suffer from muscle pain, fatigue, digestive issues, an increase in blood sugar, an increase in the risk of developing diabetes, and even cognitive issues. These are often dismissed or not properly attributed to the medication. In fact, he notes that a large percentage of patients stop taking their statins within a year, with side effects being the primary reason. This isn't to say that statins don't work at all. For individuals who have already had a heart attack or are at very high risk of a cardiovascular event known as secondary prevention, statins can be genuinely life-saving. There are many different types of statins. They all work the same way, but they have different side effect profiles and they also have different potencies. So you can't generalize these results to all statins. Also, the studies didn't differentiate between the different populations that took statins. You have to realize that just because a drug works in one group of people doesn't mean it's going to work in another group. So you really need to tailor the medication to the individual. That's one of the problems with modern medicine. It tends to treat diseases, not people. However, Dr. Malhotra's main point of contention is that the widespread use of statins for primary prevention, for healthy people with a low to moderate risk of heart disease, healthy lifestyle, or a pill. There's no doubt that statins can be helpful for people who are at high risk of cardiovascular disease, or people who've already had a heart attack or have severe coronary artery disease. But when it comes to people who are at low risk of cardiovascular disease, the evidence is less clear. In fact, some studies have suggested that statins may not be helpful in this population and they may even be harmful. This brings us to the core of Dr. Malhotra's argument, the power of lifestyle changes. He states that a healthy lifestyle that includes a whole foods diet, regular physical activity, and stress management is a far more effective and sustainable way to prevent heart disease than taking a pill every day. He even coined the term statin gluttony to describe the mindset where people believe they can continue their unhealthy habits because they're taking a statin. The evidence, he suggests, points to a minimal, if any, lifespan extension for low-risk individuals taking statins, especially when compared to the profound and lasting benefits of a healthy lifestyle. In some cases, studies have shown that the average gain in overall survival from statin use is a matter of days or weeks, not years. This stark reality challenges the idea that we can simply medicate our way out of poor health choices. In his book, A Statin-Free Life, he advocates for a radical shift in our approach to health, moving away from an over-reliance on pharmaceuticals and back towards the fundamentals of nutrition and lifestyle. He believes that by empowering patients with the right information, they can make informed decisions about their health and take back control. Okay, now let's talk about something called pleiotropy. Pleiotropy refers to the ability of a drug to produce effects beyond its main or intended effect. So, for example, statins are intended to lower cholesterol levels, but some people believe that statins can also reduce inflammation throughout the body, and that can lead to a reduction in the risk of cancer. There's some evidence to support this, but it's not very strong. So the question is, should we be using statins to prevent cancer? Well, I don't think so, especially considering the potential side effects. Here's what Dr. Malhotra had to say about that. If you're talking about statins reducing cancer risk, you're talking about a 1% relative risk reduction in certain types of cancer. So it's absolutely not worth the risks associated with the statins, especially when there are other things that you can do to reduce your risk of cancer, things like eating a healthy diet and exercising regularly. If you've had a heart attack, if you have coronary artery disease, or if you have peripheral vascular disease, statins are going to be helpful. The data is very, very clear. But the problem comes when we start talking about people who don't have established cardiovascular disease. That's where the debate starts, and there's two sides to the argument. One side says everyone who has high cholesterol needs to be on a statin. The other side says we should take more of a holistic approach to heart health, one that takes into account not just cholesterol levels, but also things like diet, lifestyle, and overall health. The problem with the first option is that it sets up an unhealthy relationship between the patient and their doctor. The patient becomes dependent on the doctor to manage their cholesterol levels and to protect them from heart disease. This is the wrong way of approaching healthcare. People need to take control of their own health. They need to make their own decisions based on the best available evidence. That's why I'm so passionate about sharing evidence-based health information online. I want to empower people to make their own decisions about their health. I don't want them to be dependent on pharmaceutical companies or medical authorities. Okay, now let's talk about the elephant in the room, Big Pharma. How much influence does Big Pharma have over the medical community and over the decisions that doctors make? Well, a lot. There's no doubt that Big Pharma has a big influence over the medical community. They fund a lot of the research that's done on statins. They also fund a lot of the education that doctors receive, and they also employ a lot of the key decision makers in the medical community. But this isn't just a problem with statins. It's a problem with almost every drug that's ever been approved. The pharmaceutical industry has a lot of influence over the medical community, and that influence can sometimes lead to bad decisions. So what can we do to protect ourselves from the influence of Big Pharma? Well, first of all, we can be aware of it. We can be aware of the potential conflicts of interest that exist. We can also be aware of the influence that Big Pharma has over the medical community. Secondly, we can demand more transparency from the pharmaceutical industry. They need to disclose all of their funding and all of their research. Finally, we can support independent research. We can support the researchers who aren't funded by the pharmaceutical industry. This isn't a call to throw out your medication without consulting a doctor. It's an invitation to a more nuanced conversation. Dr. Malhotra's work urges us to question the status quo, to look beyond the headlines and marketing, and to truly consider what it means to live a long, healthy life. Often, the answer isn't in a bottle of pills. As always, I would love to hear any comments on your experience with statins. Hit the like button and subscribe, which will help me build the channel. Thanks for watching. Until next time.